Okay, so we like to talk about funding. What are the gaps? What does AAFP want government to do? Because we know that a lot of women are not informed because there is no means of getting them informed. What is that? What are the funding gaps?
Yes, there's a lot of funding gap in terms of what the government is bringing on the table, both at the national, state, and the local government level. A few years ago, the association were able to convince government to put some money to make family planning services free in Nigeria and also to purchase commodities. And at that time, the government agreed to put $3 million annually for family planning services and buying of commodities. And during the FP 2020 meeting in London a few years ago, the government additionally pledged to put $8.3 million on the table, so making it a total of $11.3 million annually, not just for family planning, but also for reproductive health commodities. But unfortunately, that has not happened since 2013 or 12, when this thing was said to happen. In the first year, they released about $1 million. In the second year, $2 million. Last year, they released $1 million. So there are even deficits in the ones the government has agreed to put on the table. So what this means is that most of the money that we use for family planning services in Nigeria are actually donated by international development partners and multilaterals like UNFPA, DFID, USID, and other donors who have been helping Nigeria to meet the funding gap. And then the costed blueprints, which is what we are to talk about today, by the Federal Ministry of Health, puts the total amounts we need to be able to put in the family planning arena between now and 2018 to achieve a 36% contraceptive prevalence rate. As we speak now, we're on 10%, and we've been on that 10% for more than 10, 15 years, which is a shame. But the costed blueprint puts it at $608 million between now and 2018. And that's about 2 years to go. This is the amount of money we need to put on the table to be able to meet and make that target. So if you talk about the funding gap, it's very huge. But fortunately, Nigeria is fortunate. A lot of development partners are supporting us to be able to meet those gaps. But Nigeria has to step up on their own contribution.
What happens when the funding partners leave? Because Nigeria is no longer seen as a very poor country. We've been years of the economy. So
yes.
They see us as a rich country now. What happens when the funding partners leave and take their funds away?
That's a very good question, and that's where this part of this advocacy that we are trying to make today to all the people that are supposed to be major stakeholders, including government, is that we should start thinking about how do we scale up our own contribution from Nigeria to the table in terms of family planning funding. So we are also thinking, it's not just on family planning, even in immunization. By 2023, Gavi would have completely exited from Nigeria. So, and then we need $620 million annually. So this is a time that we must start thinking about how we are going to strategically fund some of these issues. And then you do know that both family planning and immunization, those are one of the major interventions in health that has very high multiplier effects. If we fund family planning properly, we reduce an enormous number of maternal deaths, not to talk of children who die also. So this is why that part of the conversation that's going to happen, because the two issue areas we are looking at today and tomorrow is funding, and the other one is policy barriers. So I'm sure we're going to devote at least today on funding to make sure that we look at all options. And then also to remind governments that as we move into the future, the need for us to strategically start taking over some of those things the donors are doing for us right now.
So briefly, can you let us know what these policy barriers are, one or two that has hindered proper family planning activities in Nigeria?
One of the major policy barriers is the ability to even put the funding as a line item, family planning as a line item in funding, because if something is not on the table, it's not on the table. And then the other one also is to make sure that when it is it's in the line item, that the money is released as and when due. Those are major issues that we have seen, and at all the levels, at the federal, the state, and the local government levels. So unless we prioritize family planning as a policy, we will not put it in the budget. And then if we can't even hide it under any other line item, we must specifically say this is for family planning, commodities, and all that. So these are some of the major barriers, the major barriers that lead to some of these issues.
So this government has spoken much about primary health care, and when you talk about family planning, a huge part of it lies in the primary health care system. Do you think much has been provided in the budget? Because you just spoke about budget provision, and a perfect, as in a distinctive line should be made available in the budget for family planning. Can't it come under primary?
Yes, a few weeks ago, I'm sure everybody in Nigeria has been aware about the issues around the fiscal year budget for 2016. It has been, a seesaw kind of thing. And for me, I don't see any major challenge in that. That is what democracy is all about. We need to converse, we need to talk until we get what we have. When the budget initially came and we were made aware of what is in the budget, when we looked at the budget as AAFP, we found out that family planning was not even on the table. So we quickly advocated to the National Assembly that nothing has been put for family planning. So they promised us that they will put back at least the $3 million that has been agreed to be released every year. That has been done. In terms of the primary health care, we also looked at issues like maternal, the midwifery service scheme, and to make sure that also that the funding for it is there. We also looked at even immunization. We also looked at how the money was sliced, and then we also found out that the inputs that we made has made sure that money also has been provided for there at the primary health care level. You know that one of the major gains that we have had as a country is that in the year 2015, the Nigerian government passed the Health Act. The Health Act said that we should mobilize 1% of our consolidated national income, and that should be put into the Health Act. And if you look at the Health Act, 50% of the budget of the Health Act will go to the primary health care level. So, and that's one of the things that we pointed out as people were deliberating on the budget, that should they make sure that they should also making sure that 1% that will come from the consolidated national revenue to go to the Health Act is provided for in the budget. If they do that, then it's going to mobilize a lot of resources to the primary health care in terms of funding for hiring healthcare workers, especially nurses, CHUs at that level, in terms of providing for medications and medicaments, and then also in terms of providing money for family planning. So we are very optimistic that if the 1% consolidated revenue is put aside under the Health Act, that we'll have enough resources to fund activities at the primary health care. My name is Dr. Ejike, and I'm the chairman of Association for Advancing Family Planning in Nigeria.
Specifically, what are your expectations
in this meeting? My expectation is that, first of all, they should have a very open ear. They should listen to us, and then also grant us our needs. When I say grant us, the Nigerian people's needs, because we are here articulating the needs of Nigerians, not just us as an organization. We are the spokesperson of women and children of Nigeria, in terms of making sure that we get adequate funding. Not just adequate funding, should be put as a line item in the Federal Ministry of Health budget, and then the money should also be released as and when it is supposed to be released, so that it will meet the right needs of the people.